So we film in blood culture competency, and I'm the phlebotomist and you're the patient. So hi, my name is Katerina. I'll be your phlebotomist. Can you tell me your name and date of birth?
Yeah, Carol, July 25th, 98.
Carol, last name was?
Doe.
No. Okay. All right, that matches my requisition. And are you fasting?
Yes.
And you're taking any blood thinners?
No, I'm not.
And if the patient does take blood thinners, you just have to hold the gauze at the end longer, make sure they don't bleed. All right, so now I'm gonna sanitize my hand. I'm gonna pretend sanitize my hand and put my gloves on. I already did, but sanitize, put my gloves on. And put the tourniquet on, locate in the vein. Make sure that this not hanging here, it's away from your thing. And make a fist. Okay, that feels good. I'm gonna go for this vein, and I'm gonna scrub for 30 to 60 seconds. And I'm gonna then allow it dry and prep on my supplies. The important part, how it's different from regular, say, butterfly competency, that you have your bottles, you need to mark the volumes. So the initial and the end, so about from here, about 10 ml. And then you also need to clean the bottles. This is the step that most commonly missed. And you leave in the top. And then technically this should be not alcohol, but actually the chlorhexidine wipes. There are purple wipes, like this. They have chlorhexidine and alcohol together, so we don't have to do iodine and then alcohol. This is already 2-in-1 prep. So technically it's that. Then I would put my tubes in order of draw, and because this bottle will suck all the air out of this tubing, I don't need any waste tube before red. But if I didn't have the butterfly would just have this order of draw. You would put a little waste tube, or if you don't want to do waste tube, you can actually use this red tube. But by the book, if this was your just because these tubes are ordered, you would take a waste tube, so another blue tub. You just put it 1 drop, and then you can draw the rest of it. This way, this tube will fill completely to this line. But this is not our case. We have blood culture, so it actually will fill completely, because this will take it all the air out. Make sure this is in correctly and it's not falling off. Tends to falls off. And this is ready. Now make sure I have everything. I have gauze, this. Okay, so now I'm ready. Okay, now let's put the tourniquet on. Now I can't touch the site because I don't want to contaminate my site. It would be false positive if in this blood cultures. I have my butterfly. I'm holding it by one wing because if I hold it like this, I'm covering my window where this drop of blood will show up. So if I hold it like this, I can see everything. So I'm still anchored with my thumb. Enter since it's antecubital area, I can actually use a regular angle, let's say 35 degrees. Put it in. I did get the blood, see? And now this will go to aerobic bottle. And I'm not gonna fill it, but let's say we fill it to this line. That's why it has to be vertical. That's why you can't have it with a straight. You fill in it until this second line or about, and then you do the same one here until it fills to this line, and then you continue with your next order of draw. And this one, I will pierce, and then now. So the rest, just to save time, we're going to pretend. And between the tubes, mix. This tube also has anticoagulant, so they should be mixed. So now the next one, it's inconvenient for me to do this way, so I just like to hold it here. And I'm gonna pretend, mix. And if I let it go, I can do that much easier. That's what you're gonna see the clinical sites do. Did I do this one? But the problem with this, a lot of times it rotates like this, and it's painful for the patient, and sometimes it can come out. And after the first few tubes, you should release the tourniquet. And also you will see clinical sites don't do that because they're afraid for blood to stop. But by the book, you need to release it like after you establish blood flow, and I did a little later. which is not so bad, but it is a mistake. So now, if I felt like the patient was moving too much, I would still hold this wing because I don't want this needle to come out. And before it comes out, you need to put gauze on, and you can shove it like this, or you can shove it right into the vein by pulling this out. But what I noticed when that was done to me was more painful, so I just take it out and then I shoot. But you can technically do it right in the vein. Okay, so then patient holds. This whole thing gets in the trash. Please hold it, okay? And in the meantime, I have to label it. While this clotting, labeling, usually we put the label on here. We don't want to label on this barcode because it goes in the instrument. So patient name, date of birth, today's date, time, initials, and extra information. This is on all tubes. Extra information for blood culture is going to be this from right, any cubital area on both bottles, because the second set might be drawn from IV, and I want to distinguish these two bottles. And when I label it all, I make sure I show it to the patient. Hey, this is your name. If they can't read this, just say, hey, excuse me, can you repeat your name and date of birth? And they say it, and then you just make sure all of this is correct. This really will save you from mislabeling the patient. Believe it or not, there were cases that the phlebotomist would forget to identify a patient in the beginning, or they heard the patient came in and they hear the name that sounded like theirs, but when they do this at the end, they realize it's the wrong patient, and then you can save the situation. So that's why we do this one. Only a few sites do this. This is the new sales size standard. So if your site doesn't do it, you can do it for your own sake, so you don't mislabel it. At least ask them for their name and date of birth again, so you can look at all this and make sure it's right. So now this is ready to be shipped to the lab. Most of the time now blood culture is plastic, so you can put them in pneumatic tube system. We still put some kind of cushion, but they're not gonna break because they're not glass anymore. So now that I'm gonna check, make sure this is clotted, put Band-Aid on. Thank you and have a good day. And then I will take gloves off, inside out, try not to touch anything. And then sanitize my hand. Now this can be delivered to the lab. So that's it. I guess I'll lose some points for